Hello and welcome to Week 5, Health Policy and Administration. My name is Dr. Rebecca Arsenault and I am your guest lecturer this week. I have spent more than 30 years in healthcare management and administration, in hospital health systems and community and public health settings. Our learning objective this week is to compare the organization, structure, and function of healthcare, public health, and regulatory systems across national settings. We will be examining the concepts of health policy and administration. So let's start with what is health policy. According to the World Health Organization, health policy refers to decisions, plans, and actions taken to achieve specific care goals within a society. According to the Centers for Disease Control and Prevention, health policy is a law, a regulation, procedure, or voluntary practice of governments and other institutions. So let's look at a few examples of what are health policies. This week you will be reading about the Medicare and Medicaid programs, as well as veteran services and medical care for prisoners. Medicare is the health insurance benefit for seniors and some disabled individuals. Medicaid is also an insurance benefit for primarily low-income individuals. Veteran services assure that veterans will have access to health care once they have served in the armed forces. And by law, all prisoners in the United States have access to medical care. Federal and state governments impose taxes on tobacco products, and some states impose taxes on sugary drinks. These are actually statements about health policies. There are many food and drug safety laws. There are a set of HIPAA laws related to the protection of medical information of patients. And there are EMTALA regulations, which refer to the fact that hospitals cannot turn an individual away from an emergency department if they require emergency care, regardless of their ability to pay. And lastly, the Affordable Care Act, or Obamacare, is a fairly recent example of significant health policy impacting individuals in the United States. This week you will be viewing a video outlining all of the content of the Affordable Care Act. Other examples of health policy. School nutrition programs have policies related to food served for students. Seatbelt laws. There are laws in states related to distracted driving, use of cell phones, and actually there are states where you cannot eat and drive without it being a violation. When employers sponsor health insurance plans for their employees, what those health insurance plans will look like are really health policies established by employers. Any wellness initiatives sponsored by employers are also a statement of health policy. And how sick time can be used in an organization is a form of a health policy statement. Can you use your sick time to stay home with a sick child is an example. So what is health administration? It is a field of practice related to leadership and management of healthcare-related organizations, such as hospitals, health systems, public health organizations, outpatient clinics, research facilities, and other healthcare entities. And in health administration, individuals worry about the overall day-to-day operations of an organization, strategic planning and implementation of a strategic plan, the overall budgeting and finance of an organization, as well as human resource management and legal issues for that particular healthcare entity. One way to look at healthcare administration is to look at management versus leadership. They're not the same thing. If you are in a management role, you are mission and purpose oriented, focusing on the internal operations of the organization, of your department in an organization. You focus on the rules. You help your staff by providing direction to do the right things. You foster and manage change in your organization, in your department, and you focus on process improvement. Your focus is on order and consistency in your area of managerial responsibility. You are an active doer in your organization. But if you are in a leadership role, often at the executive level, you focus on vision and goals of the organization. Your focus is apt to be much more external and strategic in nature. You lead by a vision. You make certain that your organization is doing the right things. Often you lead disruptively by forcing significant change within the organization to respond to changes in the environment. You value creativity and collaborative change. And a leader is a reflective learner who applies insights into his or her actions. So as we examine health policy and administration this week, there are a number of requirements. First of all, you have a lot of reading this week, so I would encourage you to get going on that right away. You also have videos to review. This video is the introduction to week 5. I have also prepared a video on public health and medicine. And lastly, as I mentioned, there is a video on the Affordable Care Act. I would encourage you to view that to better understand that particular piece of public policy. Your initial discussion post this week requires you to read Dr. Atul Gawande's 2 articles, The Cost Conundrum and Overkill. In a 400-word minimum essay, please analyze Dr. Gawande's premise that overutilization of services by healthcare providers in a particular community was the key driver of high healthcare costs. In the essay, describe whether you agree or disagree with Dr. Gawande's assessment, and why or why not. Provide a minimum of 3 references from professional healthcare literature to support your essay opinions. And then you are required to write a response post. Respond to a co-learner in a 300-word minimum essay by agreeing or disagreeing with your co-learner's analysis of Dr. Gawande's premise. In the essay, present at least 2 other factors that can contribute to high healthcare costs in any community, and use a minimum of 2 references from professional literature to support your response. And this week, you will also be completing a quiz. Again, welcome to week 5, and I encourage you to let your instructor know if you have any questions. I hope you have a great week. Thank you.